finally, the last topic, and I know we're beyond our show, but I don't want to end this to talk about female sexual dysfunction. You know,
Right.
in my world of urology, we deal with sexual dysfunction a lot, and we have Viagra, Cialis, Levitra, we have so many vacuum pumps, injections.
Right.
But this is a kind of field that it's kind of like a taboo. Nobody talks about it. I think it's kind of like embarrassing for a lot of women. It's a hidden agenda. And I was actually quite surprised to see that 43% of women out there actually suffer from some sort of like female sexual dysfunction.
Right.
Have you heard of this? And what do you think about this? And what do people need to know?
Yeah, well, this has become very common, but this is a little bit more beyond, honey, I've got a headache tonight type of thing. This is more persistent, a persistent lack of desire to have sexual intercourse, or an inability to be sexually aroused, or even having pain during intercourse, are all criteria that fit this description. Or for this disease. Fortunately, things have changed a lot, so we can actually treat this, whereas before it was more difficult to treat. Number one, women didn't want to talk about it, and number two, it was sort of thought, well, if you just change your health, your lifestyle, then, you know, or act more interested, don't be so tired all the time, that it'll get better. But there are actually medications to alleviate this disorder for women. For some women who need it. And sometimes you also have to think about medical conditions that may be causing the lack of arousal or desire. Kidney failure, cancer, depression, pregnancy. Yes, pregnancy is a disease. No, I'm kidding. It feels like it when you're going through it.
No,
but pregnancy alone.
Postpartum depression
exactly.
is a real entity.
So there are circumstances or medical conditions that are actually are an issue for having a poor sexual arousal or lack of desire to have sex. And those may or may not be able to be fixed, but certainly if it's just a matter of stress or lack of estrogen, those types of issues could be treated.
I mean, based on what I see is that you're right. A lot of these medical issues such as diabetes and heart disease and, as you mentioned, kidney failure and liver disease, they're all part of it. But there's no question that there are also hormonal changes. That's part of the natural part of going into menopause, etc. And you can seek help. And that really, lack of lubrication and pain while you're having intercourse is one reason not to really engage and stay away from it. Now today they have a lot of vaginal lubricants that you can use. Replacement of hormones, estrogens, under the guidance of your doctors could be very helpful, right?
Right. And I, like you said, I think we don't like to talk about it, or we don't recognize that it's actually a disorder, because you feel like, you know, especially if you're a stay-at-home mom or a working mom, right? You're tired, you're working, you've got to get home, feed the kids, do the laundry, do this, so you feel like, oh, I'm just too tired for it. But if it is a persistent issue, it is something that could potentially be addressed. We just have to be willing to discuss it with our physicians and recognize that there is an issue.
There were some new medications that came in the market. I'm not sure if that's really panned out to be really helpful.
Right. Well, there's flubantarin that is actually was initially studied as an antidepressant, and then has now been FDA approved in 2015 to treat hypoactive sexual disorder. And it is shown to be helpful, but there are side effects to this medication, whether it's drowsiness, fatigue, nausea, which is a buzzkill anyway. For all of those are a buzzkill for that. So certainly, you know, it has its side effects, and I think this is one of the key components of this. It's an issue if it's affecting your lifestyle and if it's affecting your relationship with your partner, then it's something that you probably want to be treated. If it's not affecting your life, if you don't feel like it is, then it may not be something you want to aggressively treat, because like everything we do in medicine, there are side effects.
So, you know, I think what I hear from you is that you don't need to hide, even though it could be embarrassing, but it's really not. And the doctors are not going to be judgmental.
Right.
And there are so many mechanical issues like ovarian cysts, or you may have endometriosis, or you may have other things that can cause this kind of painful intercourse. And by seeing your gynecologist, getting the pap smear, making sure you have the vaginal exam, etc., you can really take care of this. So Obviously, there's a lot of benefits to have like sexual intercourse, both for men and women, health-wise. So you need to see someone, and there would be treatment for this. Unfortunately, we ran out of time. It went so fast. I apologize if there was any technical issue at the beginning of the show. We're going to try to figure this out next time. But we enjoyed having Dr. Abloh with us.
Yes.
And we look forward to seeing you next Sunday around the same time at 12:30. Cynara, thank you again.
Thank you.